Hi, welcome to our podcast. My name is Pablo,
My name is Omar Escajeda.
And I'm Diego.
and today we're gonna talk about PTSD, focusing in older people in a chronic phase. The reason that why we should choose this topic, it was for because we live in El Paso, Texas, and we believe that this topic can help a lot to our community because it is a city with a lot of veterans, and sadly, this is the people that suffers more this mental condition because of like the traumas that they experience in war. So we believe that it's important to explain how like the organizations that we have here in El Paso, so you can like you have a you have family or know people who have who experience with this mental condition. You can like know what it is and how to help them.
Exactly. As Pablo was saying, today we'll be talking about PTSD, and we'll be concentrating on the senior citizens on our elderly population, and especially in the chronic stage, which is when PTSD lasts from years to decades from the moment when the traumatic event occurred. Um, a lot of the times we might think about PTSD, and I'm sure a lot of us had heard it before. Maybe the first thing that comes to mind might be maybe a veteran, maybe someone who's a younger adult who suffered from an accident or maybe some type of violence. And yeah, this is still true, but a lot of our elderly population brings PTSD as well because they had a lived for longer. They might have experienced war, maybe some type of abuse, major losses in their lives, violence as well, and they continue to carry all of these memories silently throughout their life. According to the National Institute of Mental Health, PTSD develops through suffering, experiencing, or witnessing a traumatic event, which is marked by intrusive memories, nightmares. A lot of people who suffer from PTSD have avoidance as well. They are hypervigilant, even if there's not a danger anymore around. And what makes PTSD challenging, especially in our elderly population, is that these symptoms are often mistaken by maybe depression or maybe just normal symptoms of aging. And that's why a lot of times patients who are suffering from PTSD are underdiagnosed. So in this episode, as Pablo mentioned, we'll be talking about how PTSD manifests. We'll be talking about some of the risk factors that keep PTSD active. We'll be going through a real case study, and then we'll also be talking about how it affects in their daily lives, some support groups, and organizations locally here at El Paso.
Okay, so I'll give some characteristics about chronic PTSD in late adulthood. Well, some of them will be long-lasting emotional and physical distress. So they would get to have like panic attacks. They will get flashbacks and persistent anxiety. Also emotional numbness. Then they would have like sleeping problems or nightmares, since based on the events they experience as for example, a veteran. They wouldn't be able to sleep well as they used to because of what they have experienced, and they will have to, they have this awareness while they sleep that they gotta be alert, and that makes them have insomnia and not letting them sleep well. And also, they would have like social withdrawal. Like, for example, they would isolate from their family members or friends, since they feel like they can't trust these people like they used to, because like based on the events and all that they have experienced, it's just like, this is a trauma. It's hard for them to trust again and to like share some stuff they used to with their loved ones. Then also, they will have headaches, stomach pain, a lot of anxiety, depression. Since I mean, it's really it's a big deal, and it's hard for them. So I would say that these characteristics are what makes them to come back like real hard, and then they will also have like flashbacks or like these that makes them have these like panic attacks. Like for example, um, I don't know, like whenever they hear like how can I say it? Well, whenever they feel like they're in danger, they get to have like anxiety, panic attacks, and they get to I don't know, just like run and ask
Yeah,
for help.
and this is something that is important because, like as Omar said, it is very common that a lot of mental disorders have in common certainly some symptoms. So it is important to understand like which symptoms as individual with PTSD get. Also, it is very important to know that this is not a disability. It is not correct to call it like that. It's a mental disorder or it's a mental condition, but never is a disability. They are fighting their own fights. So, well, we never have to call it like that, like as a disability.
Exactly. And some of the risk factors that keep PTSD active in all of these patients, especially in our senior citizens, can be something like major losses. Maybe the death of a loved one, or maybe that sense of that they're losing their independence can reopen some of these emotional wounds or trigger memories of past traumas. There's also health problems and hospitalizations. Maybe they're suffering from some type of chronic illness, or they have stayed in the past in hospitals for long times, which can remind them of past traumatic events they have in the past. And as Diego was mentioning, that can increase anxiety, sleep disturbance. They can have insomnia and a lot of other things as well. There's also the social isolation part about PTSD, which is another risk factor. Which is, as we all know, a lot of our senior citizens spend a lot of time by themselves. Maybe they live by their own. Maybe they live in a facility when there's not a lot of people, or maybe family members that they can talk to, or where they can seek some type of comfort. There's also early life trauma resurfacing, which is when they get all of these memories back from war, maybe some type of abuse they went through, an accident, and a lot of other things. And as I was mentioning, because they have a lot of time by themselves, they have the time to sit down, reflect, and they bring all of these memories back. And a lot of the times they don't differentiate because of this cognitive decline they have about the past and the present. They may think that all of these memories that they are having is actually in the present, which it was something that was in the past.
So yeah, let's knowing this, let's pass now like to a case study. Let's think about a 70-year German veteran who have suffered like the Second World War, and well, this is gonna be a person who's gonna have experienced difficult scenarios, and well, how as we say, like the trauma is the worst thing here, and this is what we need to like treat or rehabilitate so we can lidiate with the PTSD. One of the most therapy common that can help in these cases are narrative exposure therapy, which helps to like normalize these memories that they get, to understand like, okay, this is not a thing that is happening now. This is a past experience. I need to understand it. And how it works is the individual is gonna like talk about his experiences in his life, and with the time I start talking about the scenarios that after the time become the PTSD, and with it they, like how I say, start like normalizing these memories and starting treating like that, like a memory.
Well, now some of the impact that chronic PTSD affect on daily life could be like on sleep and rest. As I just said, on based on the characteristics, since they will be fatigued, will they still have the alertness of having to stay awake? They will keep they wouldn't be able to sleep. Also, based on this would affect on relationships and social functioning, since they would be like more lonely. They would be like they would isolate more. They would stay away from people since they feel like they can't will trust or rely on people or anyone.
Exactly. And I think a great example about how PTSD affects people or the early adults in our community, it's an example that someone told me one time. I think it was one of my grandparents who talked to me about he had a friend who went to the Vietnam War, and he suffered from PTSD, from chronic PTSD. And what usually happened to him is that every day in the morning he woke up at the same time, because I think there was usually like a truck or something that passed by his house, and that reminding him of a lot of the things he went through that war. So, I mean, just suffering from PTSD, I couldn't imagine how complicated it is and how it can affect your daily life in doing simple tasks. Like, as for example, I remember he told me as well that he couldn't watch the news because a lot of times he would hear like helicopters or maybe a lot of crowding within the people, and that brought a lot of those traumatic events back.
You're like, for example, like flashbacks or like those memories, and they will get anxiety, and then their heart rate would like increase also. And several studies say that chronic PTSD affects their memory, and also that their mild cognitive impairment would like lead to dementia. If that's what
Dementia.
dementia, yeah. And yeah, like that's basically it. That it affects a lot on these
your
people
daily life.
on their daily life. Yeah.
Yeah, I like what you said. Now, well, I want to talk about some strategies that, as rehab, or strategies to treat individuals that get this mental disorder. Well, first of all, I think it's very important to have empathy with these people. I mean, if you're starting like being hard with them, like trying to say like no, like what are you seeing? It's no normal, and being hard with them, and in some things like how you can say it.
Yeah, like if you lose like the patience with
Yeah,
them,
exactly.
yeah, like you wanna like for you it's normal like to be like stay calm or like do several things, but for them it's really hard because they have the trauma, so they can like hear like big noises or like several stuff. So yeah, I mean I'm sorry for interrupting,
No,
but like
no, I like it.
I know what you're trying to say, like to be patient with them and stay calm since they've been through something that's very big, and we gotta like take like baby steps with them.
Exactly. So that's what I want to say. Like, thank you for supporting me in this. Like the patience and the empathy, it's crucial in these cases, and and it's a very good strategy to help them. Also, like some organizations that we have here in El Paso, for help these individuals. We have the National Alliance on Mental Illness, which is a national organization. There is not just in El Paso, but is one of the most biggest organizations that help with all the illness, but you can focus like in the PTSD. Also, we have Emergence Health Network, who is like for veterans. Also, the Veterans One Stop. That one is too for veterans. Also, we have the Rio Vista Behavioral Health in El Paso VA Vet Center, and I don't know if I'm missing one. Probably let me think. Treatmental Health Texas too.
Well, yeah, I mean,
I think we have covered all the things that we wanted to talk about PTSD. And as Pablo said in the beginning, we need to make awareness about PTSD, which is something pretty common in our community. So yeah, thank you guys for listening. I hope you guys enjoy it.
Thank you.